A last-minute settlement in a major opioid lawsuit in Ohio could pave the way for future action by major drug companies. 3 of the nation's biggest drug distributors reached a settlement with 2 Ohio counties right before a federal trial was set to begin. Fox Business correspondent Grady Trimble has the details.
4 major drug companies reaching a tentative settlement Monday, just hours before the first federal trial over the opioid epidemic was set to begin. The settlement, reached with 2 Ohio counties for $260 million, will see AmerisourceBergen, Cardinal Health, and McKesson paying a combined $215 million. Israeli drug maker Teva will pay $20 million in cash and supply $25 million worth of Suboxone, a drug that's used to help treat opioid addiction.
We are looking at utilizing this money for treatment and getting people into programs and assisting first responders as they deal with this crisis.
The counties had originally asked for $8 billion, but say the settlement will provide immediate relief to communities hit hard by the opioid crisis.
People are suffering now. People are dying now. We have to deal with these issues now.
More than 2,000 similar cases across the country allege that the pharmaceutical industry pushed widespread use of opioid painkillers without properly warning about the risks of addiction. While this settlement only covers the 2 counties in Ohio, it now leaves more time for drug companies to continue to work towards a nationwide deal.
I hope the people in Washington acknowledge the situations that we have been bearing and pass laws to prevent these actions from ever happening again in this country.
The pharmacy chain Walgreens was also named in the suit, but it continues to defend itself against the allegations and hasn't reached a settlement. In Cleveland, Grady Trimble, Fox Business.
There's new evidence tonight that a common virus could be causing a rare polio-like illness in children. That mysterious illness, acute flaccid myelitis or AFM, which can start as the sniffles but quickly paralyze children. Researchers studied the spinal fluid from 100 children and found enterovirus antibodies in nearly 70% of children with AFM. Enterovirus is a common seasonal virus with symptoms of fever, sneezing, and body aches. Health authorities have confirmed some 590 cases of AFM in the U.S. in the last 5 years.